through a little bit of my journey over the last, I don't know, since 1947 maybe. Uh, this picture has two important people in my life, which I am extremely grateful for. And so this was the first, I think the senior guys can probably ignore the next 10-15 minutes. This thing is more for this group of people, the youngsters who are probably starting off their life, thinking kal kya hoga, kal ho na ho, etc., right? So this was the first national conference that we organized, or we were forced to organize. And you can spot this, I think, I told you, two important people, right? And I don't include myself in that. So it's Dr. Koopchandani and this girl here will probably, I'll introduce you to her later. And when I joined my DNB in Jaslok Hospital in Pediatrics, I was told by Dr. Koopchandani and many people that rheumatology is like you are going to be the Sherlock Holmes, James Bond, and we all grew up watching this famous For Your Eyes Only movie. But what life has taught me over the next 15, 17 years is the I's have been replaced with I's, the alphabet I. And the first I that most of us get introduced in a medical college is idiopathic, which we know that doctors are idiots and patients are pathetic. And we thought that rheumatology is the perfect example to sell our specialty till today, where everything has changed. Throughout our life, most of us and most of you guys are always going to be iatrogenic. Ma'am, I'm sorry. Both the ma'ams, I'm sorry for this. It may not be very interesting. It may be boring. But I'm just taking advantage of the fact that I don't have time restrictions today. Life will throw a lot of idiosyncrasies at you guys. And your patients may also throw idiosyncrasies. And we will have to navigate through them. The ultimate aim of coming here and doing life is not to be an idiot in front of the patient. If you have to be an idiot, you have to be like three idiots, the cleverer phenotype of idiocy. This is what even Kevin Murray taught me, that you need to do things with passion, and don't worry, rheumatology will at least give you a lot of academic gratification. And once I finished my fellowship and I decided to come back, and I was jobless, doing nothing. The pediatrician बोलता था रूमैट करोगे तो पेट नहीं भरेगा, rheumatologist बोलेगा वैक्सीन भी लगाना चाहिए, and वैक्सीन लगाएगा तो पेशेंट नहीं रेफर होगा. And that usual story which most of us get stuck into. And I literally was thinking, why did my dad name me as Vijay? And for people who are not the Gen Z fellows, this is Amitabh Bachchan, I have leased my name in 21 movies, and the quiz for tomorrow is name them, right? Vignesh probably has a more happier face than how I used to look as a kid. This was the better part of my DNB training, and we started talking, and as life would take me, I started talking at Navi Mumbai and Thane, and I started the concept of just try and bombard yourself on pediatricians as a primary audience, and then talks, you realize that I used to like driving, so I used to travel all across to the whole corners of Maharashtra, selling the same PPTs again and again and again and again and again. And on one such, and someone had told me that make 4 PPTs in life and keep reminding people again and again and again. That's what I did for almost 6 to 8 years. And sooner than later, this happened. So this was 2018, where when everyone used to come and tell me lose weight, lose weight, lose weight, and nobody told me I was fat. So, and in the quest of selling my specialty and paying off my EMI, this thing happened on the Bombay-Pune Expressway. So when I saw Dr. Suma's message about Dr. Danda, November 6th is my second birthday. So people should not forget to wish me after 10 days, right? So this happened on the expressway, and I escaped without any, I'm not very proud to show off this slide, but the youngsters in that quest, in that 2 minutes of disaster, you actually everything from birth to Amitabh Bachchan to Dr. Koop Chandani to rheumatology, everything flashed in front of your eyes. And all you could say was a silent prayer that if I have sinned, please kill me. If I have done anything good, distribute it to all the well-wishers. But don't keep me like Superman, right? We wanted to be James Bond. And then as life would take over, so the whole thing, universe conspires, as they say. And this hospital happened, the national conference happened, and Anand said that you bought the car using NCPR ka paisa. Easily the car got paltoed. Suma went one step ahead and said, what car was it, Vijay? I said it was a Creta. Suma says, now it's ex-Creta. They all made fun of me. And I said, yeah, that's true. But agar conference ke paise se kharida hota, to shayad main aaj zinda nahi bachta. It's as simple as that. And then when I showed this picture to Dr. Koop Chandani, he said, Vijay, who buys a car for 18 lakh rupees? The most expensive car I have purchased is 10 lakhs, which is true. But I said, you never taught me that part of life. The economy part of it is still with him. And I said, I am alive because of the 18 lakh ka car. That's about it. And even the insurance company was angry with me that, बोला हड्डी भी नहीं टूटा है, कार कैसे तुम उसमें थे? You know, so they wanted me to show an X-ray with a CRMO or a fracture or something, right? So that's just an introduction. But then when NCPR in Bangalore happened and Suma spent 1 hour of her life to convince me to become the president, I said, ठीक है कर लेते हैं, एक बार अभी गंगा नहाना पड़ेगा कभी तो. And this was, and I said what I was doing unofficially, because this rhythm or rheumatology training module concept actually came from Dr. Koop Chandani during Satish's conference in Vellore, and we spent one full morning talking about it, dissecting it and everything, and we said it's gone to cold storage. And Dr. Amita kept sending me mails for the first 6 months, and then she gave up. Nothing is going to happen of the module. And then I said, let's at least refine it, and I started doing it very, very unofficially. We tried pushing it to IIP during Anand's tenure, Dr. Suma's tenure, but nothing happened. The purpose was, while we talk about all the advances today, I still thought we should be feeling the country's pulse vis-a-vis awareness, availability, etc., etc. The second thing which was always bothering me was the website, and I think the website was very, very primitive and needed a definite upgrade, which we'll talk about later on. The word day was something which was very close to my heart, because I believe that most of the pediatrician audience or our colleagues who will help pay your EMIs are still have a short-term memory loss. So the word day was just 18th of March, we started from alphabet A, we have reached alphabet R and S now. Just circulated to all the pediatricians as a ready reckoner. This has been updated on the, uploaded on the website also for, and it's, I thank all of them, all the colleagues who will touch upon. The more important job what Vignesh and me had was dodging the IAP, ICP, googlies which keep coming from time to time. And the most important agenda as decided in Dharamshala was obviously the FNB and DNB accreditation, which Dr. Sujata was leading us through. So like I said, this was conceived, the rheumatology training module was conceived way back when you guys were not born. So 2014 was, Satish? 12, correct? And then me and Manjari got involved with this. And then when I took over, I got my 3 friends to iron out and polish out all the stuff for me. And then we came out with, the RCIAP had become PRS by now. And the rheumat training became rhythm as we renamed it. So rheumatology training module, something like asthma training module, and try to take it out to as many people as possible. So that was the purpose. And my other purpose was, along with promoting the specialty, it made sense to promote the people who are also taking it up as a career. So promote our newer members to the local audience, which may make life easier for them without necessarily, paltowing your car on the expressway. That was a kind of an experiment. So at the risk of being called a pappu, I decided to call it a Rheumat Jodo Yatra, which, and as it turned out, the president from Navi Mumbai became the president of CIAP, and I checked with 2 pharma companies, got them to sponsor about 10 programs, is all I promised. One program was a lakh of rupees, what I promised the local IAP. And we launched this at Pedicon, Ahmedabad. And it was reasonably well attended, thanks to Pedicon, 75 people. So the thing what we did was a pre-test, 4 hours of basic science, acute chronic arthritis, CVD and vasculitis. And then based on the results, I said, let's take the top 5 and the last 5 and try if we can go around trying to make some sense of it. And the first launch was Northeast. So I landed at a place called Dibrugarh because the guy from Dibrugarh was the last in that pre-test. This is not my car or any fancy car. This happened to be the medical college resident ka free ka gaadi. Off call ja raha hai na, tu gaadi leke sir ko de dena. And then I set off with the usual pattern recognition skills using all these examples of a kacha limbu. You see these huge lemons, you are in Assam or Northeast, And then I connected with a few of my Nair Hospital Day colleagues who are in teaching positions. And then the other good thing was I introduced a new guy to Northeast. So he looks similar, except that he looks like a politician these days. So Dhruba Jyoti was introduced to Assam, and I found him a very nice guy because till now we never interacted. It was always this PGI, Bombay, CMC, and this was a separate trip. So 2 days we enjoyed each other's company. He talked it out. We had a great time, and from Dibrugarh we went to Rashnaland. So we went to Guwahati, and Guwahati was again almost 50 to 55 delegates in the evening, and I got almost the worst anaphylactic attack after eating one of these things, tamul and betel leaf. It was super bad, but it was good fun. And for people who thought that Vijay is on a junket on pharma money, just having fun in Northeast, etc., this was the limousine sent to me by Srinagar's government hospital. So I said, ये तो ठीक है, बम फट गई तो हम इसमें आ जाएंगे, लेकिन where's the car to reach the so इसी में बैठ के जाना पड़ेगा, दोनों purpose solve हो जाएगा, So we took this ambulance, and Anand had joined me there, and Anand joined me, and I made another new friend called Akib. So Akib Bande became our new friend, and Akib was introduced to Srinagar. He was already in Srinagar, but we did this module with Akib in the fray. And Akib, we could manage to unmask Akib also. The first day he came with a mask, but by the end of the program he had opened up nicely. So this was Srinagar, and again it was not a junket. We stayed in a government hotel, we stayed in a government lodge, and the sad part is IAP said 60,000 is your and Anand's aeroplane bill. तो 30,000 में CME करो. तो I had to tell IAP that 30,000 में आनंद और विजय से दल लेक में घूम के आएंगे, हम नहीं आ सकते, या आप कुछ जुगाड़ करो. To balance that, what I did was I held a program in Navi Mumbai with the best of transport, which happened to be my new car with my hard-earned money, not conference money. And the New Bombay thing, I only had to do to save some money and send that money across to Srinagar. So it's robbing Peter and paying Pan or whatever. So I did a small program and I introduced Divya Ramados, the next fellow from Dr. Kupchandani's stable, to Navi Mumbai also. You may call it autoimmunity, but I feel it's fine. She deserves her own story. And Divya gave a nice presentation on approach to collagen vascular disorders. So that was part 3. I'm not going to bore you with all the stories. Bhilai was an unexpected thing because I just got to know a friend, Dr. Narendra Motwani. So he said, why don't you come and do a program? So on 15th of August, these guys decided to surprise me with idli sambar. I said, why would you give idli sambar to a Madrasi? But in the process, the maximum audience was in Bhilai, and the best thing that the compliment that we got was, this was a doctor by the name Dr. Bafna, who is a Padma Shri, and he came and said that I have been a Padma Shri, I have done so many things, but after listening to your 4-hour meeting, I realized whatever I have been doing all throughout is all shit. He literally used this word. And he was there till the last ball was bowled. And I met a new friend in Bhilai this time. I mean, she doesn't look new, but I found that she's also a fellow Cancerian, which explains our idiosyncrasies and mood fluctuations, etc. And we really had a nice time together. We are all worried about cyclones. Bhilai I was thinking कहीं और से attack होएगा, नक्सलवादी आएगा types. But this was another kind of an attack where one of the Bhilai hotels where I stayed, this commode wouldn't stop. It wouldn't start and it wouldn't stop. So and more traumatic was the next day where they fed me more idlis. And I literally have to thank them with the heart of my bottom. And then you start realizing, and then you realize that, these are small things where, you have to, this generation who does this on WhatsApp, status, gratitude, this is actually the moment where, one side you have a Padma Shri, the other side you have this commode which would, and then Bhilai, 15th of August, I was in Bhilai doing commode fixing. While my colleague, 25th of June, was busy educating me on jalebi on steroids. He's called Jaleba. I never knew that. She was busy focusing on her priorities, if I may use the word. Then we went over to a place called GOA, where Dr. Vaishali Deshmukh had topped the pre-test, so she deserved a thing, and Suma wanted a holiday in Goa. But again, we took all sorts of transport and efforts, and Mahesh joined us, and they made me eat fish. My mother curses them till now. And Goa had a decent turnout, 40 delegates, which was a good story. And the last thing is, I think we went to a place called Jaipur, because just before that I tried selling Dharamshala to Jaipur and Jaipur had refused, the NCPR. So I went to Jaipur, and again the hall was reasonably packed, and we introduced a new star to Jaipur this time. So Abhay was introduced. Abhay talked on chronic arthritis, if I remember correctly, and again the Jaleba, or my fellow Cancerian, turned up in Jaipur, and we did a program in Jaipur also. The last program of the year before we ran out of funds was Kochi Pedicon, and again Suma was kind enough to host the program, and we did program number 8. Now, after that, I have done 2-3 programs here and there. But the thing is, what happened subsequently was probably, these are all small gains. I don't know how much of rhythm they remember, but this kid was, I call the pediatricians antigen presenting cells. So each one of you should probably be good APCs who pick up all the DAMPs and PAMPs. So this girl was just they rang me up saying that this is a girl who's very sick, and they know that when they call me, they have to send CRP. And they just sent me a picture. And this had systemic hyperinflammation written all over it. And it looked like a Kawasaki disease shock syndrome. And then she reached Jupiter. Usual question, 2 or 10 or 30 was the question they asked. I said, please pulse 30 mg per kilo, just send a kid here. And this is what early referrals could do, and this child made a complete recovery. And this could not have happened. I don't take credit that rhythm has saved the life, but it was just that we want pediatricians to be good traffic policemen, just route the kid to the right place. And the rest is history. This kid was being labeled as Steven Johnson syndrome, fever for a month, and I said, just remove her neck and see what is this. Oh, maybe it's butterfly rash, right? This girl turned out to be, and they say SJS, TENS, leukopenia, lymphopenia, and Pranav's write-up on lupus. And our word day on CRP and ESR, he said it looks Steven Johnson, but you had told me leukopenia, lymphopenia, negative CRP, high ESR. Kuch to gadbad hai, matlab pakka gadbad hai, and this is some remote pediatrician somewhere, and it turned out to be lupus with severe cardiac failure, and this is the girl today. And Devashish might get a hint. This is also from a religious place in Maharashtra, where we had left everything on the God. So this girl was complete recovery. Net, the problem that I am facing is I started a free OPD now on phone, thanks to Rhythm. 2 JDMs from Raipur. Northeast has become my backyard. So after Modi ji, I think I have traveled to Northeast the most, because as I found out, many government hospitals in Northeast have IVIG in-house. But rituximab has to be channelized via Boston, Bangladesh, Nepal, Pakistan. It becomes a problem. And I have seen the worst of SLE patients in the northeastern part of the country. So Assam, for example. And you could assume that there is a bit of the Asian influence there. Bad SLE, nephritis, availability, everyone is on steroids. There is not even a mycophenolate mofetil in northeast, or I don't know about Assam, but at least the Nagaland, etc. So where I am coming from with all this is, all of us probably need to do a little bit, when it may sound like a bit of philanthropy, but I guess end of the day, India is still a developing country vis-a-vis pediatric rheumatology. The pediatricians, if I go and ask anyone, 2 saal ka bacha, 1 knee joint, what test will you send? They won't have an answer, which is a sad part of it. Forget Kawasaki's and auto-inflammatories. I thank all these gentlemen here. Chetna still doesn't have a photograph on Google yet, for helping me with the words, and we will hopefully take RSTUV XYZ for the next story. So what has been my impression with Rhythm is, I started off doing it as a pilot project because it was close to my heart. And then I thought, why should I only suffer? So I got a few like-minded individuals. And I realized lots of work in the country. I also realized the flip side of it is there is a dearth of passionate professionals, lots of ignorance, myths, misconceptions still exist. And I think there is a definite need. The pilot is done, the basic talks are ready. You throw in a PID module in this, I think it is near completion. And then we leave it to each person to individualize it and take it to as many people as possible. And obviously we can't do it as a module because you don't expect a pediatrician to teach like an asthma thing. So we have to do it as a mission, right? And I think the FNB, DNB thing that we have started will probably take its course to get qualified. But the key word to me is still passionate. If I may be qualified, but if I lack the passion, I may not be able to do a good job. And the biggest adverse effect is that 3 people came to me post rhythm and told me that I have done the Euler fellowship and now I have started pediatric rheumatology in the hospital, which is a bit scary for me because I always am afraid of, while we are doing it in good intention, half-baked cookies is a problem. So I said there are increasing numbers of patients also, so you guys need not be insecure. Patient आएंगे आप लोग के पास. There is an increasing workforce, which we all know. There is definitely time for more collaboration, cooperation, and exchange of knowledge. I was telling Vignesh that I am super impressed with the work you do, but how do we use your knowledge for our day-to-day practice? Because how do we breach this private hospital, government institute, teaching institute bridge? How do we bridge this divide? In an ideal world, all of us should be collaborating. So I'm pretty sure you'll have more data. And all this will come with only selfless, passionate, persistent efforts. And I think while we talked all that we did today, the plight of the general pediatrician is very, very lagging according to me. And we still have to take care of the families, which, Debashish, you're disturbing me. The most important line is we still have to care for the Raju Rastogis of India. Bhindi 12 rupees ki ho gayi hai. I hope you guys remember that dialogue, right? That Khujli wali roti family still exists and you have to take care of them. I thought I should give this a new name, what I kind of attempted should probably be called but Raju Rastogi, what Dr. Raju started, I will call it pre-Rajulization. I think the pilot has been done. I'm sorry if you are affected by this, but this is coming straight from the heart. And this is just a picture of people who I also did stand-up comedy to sell myself in Navi Mumbai. I still drive the same express highway. I still eat a vada pav because nobody comes and says, Doctor, tumi pan vada pav khatat ka? Do you also eat a vada pav? And it actually turned out to be one lupus patient who came, and this is the last thing I promise. Then I'll hand it over to Vignesh for the more official stuff. The weight loss journey, everyone used to say, Vijay, lose weight, lose weight, lose weight. There was one cute lupus kid who was about 14, 15, and I managed her till 17, 18. For people interested, can come and meet me. I'll show you the picture. And she said, Doctor, now 3 years have been done. You said kidney involved hai to 3 saal, kidney nahi hai to 2 saal. I am in clinical remission. I am in lab remission. And believe it or not, she said, I am in serologically active but clinically inactive. I said, super, I have educated you enough. I don't have an excuse to not stop your medicines. So I'll continue only HCQS. What's the bargain? What will I get? She said, I'll give you a hug. I said, okay, be my guest. Shah Rukh Khan, that hug is still there in my phone. And then this Debashish is being a pest. This girl actually bartered with me, and then I said, she asked me, what else? I asked her then, so she gave me a hug, we clicked the selfie, and she said, before leaving, she said, one more thing, you look very clever, you saved my life, but if you lose a little bit of weight, you will be just fine, and you don't need to wear a tie to hide the, and he said, sorry. And then, so I used to wear a tie to hide the buttons opening in those days. And this, everyone said lose weight. This girl had this pure heart to say you are fat. And, and that just, and then when she walked out, Amdekar sir and Dr. Kupchanani never said patients also observe you, You are observing is fine, but patient has been observing everything that you do for 3 years. And then when she went out, I looked at my feet. And I said, I can never have HLA B27 because I can't see my feet. So that set the ball rolling, and I said, work smart, work hard, but call yourself hardly working. I call the pediatrician should be hard working. The rheumatologist should be hardly working, using your head and not actually do what I try to do, which probably is a lesson. The last slide is obviously the other important person in my I owe her a lot. She's been the rock, and I still curse her for being his favorite. I remember the DNB days when she and Jyoti used to be around Dr. Koopchandani. सर का चश्मा गिरा तो उठाएगा, अभी हस्बैंड का चश्मा उठाएगा तो पूछती नहीं है वो अभी भी. So this is my wife. I'm sorry. Thanks. Each day in those initial phase when you were kind of, in Marathi there's a phrase, no, sushikshit bekar. You were jobless, but you think you were educated, and I think Dr. Sujata, Dr. Amita, Dr. Koopchandani, they were all supportive, but then you have to earn your own bread, as they call, and this, please find a good spouse. That's the most important part, because both of us were orphan specialty. She's a developmental pediatrician and I happen to be what I am. And every time when you saw low, she used to be there. And then you start taking small pressures. This girl said Kevin Murray can go to hell. I can prove that hypermobile kids can have a good handwriting also. And she actually sat on my table writing, proving that not all of them will have clumsiness. And this is what you guys should be working for, you know. Paise aate rahenge, but I guess the end of the day, this is the kid with that gangrene I showed you in the morning, Kawasaki gangrene. She comes and gives you a social smile before the mom. This is the kid with that huge anaconda inside. This is a kid who happened to come to me from Bangladesh. You know, so these are small moments which will give you happiness, and none of the pediatric rheumatics will starve or die of starving, because you heard working for peanuts, but this is one family which gets me onions from a Nasik kind of a place. And last, when have you met? During the onion season or the chili season? That's how they introduce. Okay, then I remember ki wo, you know. And then this is my famed Karan Johar's wall of fame, as I call it. So, you know, it rubs on. It's not to prove that I am the best, but it helps me break the ice with the new patient who walks in. They see this and they pray that I'm not the only one who's suffering. So there are many more kids who need your help. And the last thing is, obviously, this is one thing which, again, I must say I'm not proud of, but it will always remain with me. And I keep bragging and boasting to my friends that I have almost done everything in life, including committing suicide. Only thing left is to murder someone. And if I find any of you guys doing something crazy, I'll probably get the same car and murder you guys. So you have to be extremely, patient, passionate. I think you should be persistent. वो खरगोश बनने की कोशिश मत करो. Mutual funds are still better than stocks, because Dr. Koopchandani never taught me stocks, and Putin and etc. Professionalism, I think it's a key ingredient. I think the Gen Z and Gen Alpha will do well to just slow down a bit. And these are two of my favorite dialogues. I often relate with this because, I never thought I could die tomorrow. But that almost happened. And then obviously the phrase is, जब तक जिंदा हूँ तब तक मरा नहीं, जब साला मर गया मैं ही नहीं हूँ. And which is why I still feel emotional. What did I do wrong to go through it, and what right I did to just escape with a scratch on my hand. And then, you know the Three Idiots ka dialogue. काबिल बनो कामयाबी झक मार के पीछे आएगी. And this is coming from a person जिसने टांगे भी तोड़ी, गाड़ी भी फूकी, और मुझे एटीट्यूड नहीं है. I think it's more about having a right aptitude towards life. And this is my parting message is, even if you win the rat race, you will still be a rat. Do you want to be a rat? I leave it at that. The more important part, I will introduce I think he's the best secretary you can ever have. Very polite, very obedient, supremely cerebral. Only one fallacy was he used to call me in the evening. Like Debashish ka khatam hua to Vignesh used to say, "Good evening, sir. Is it the right time to call?" And I would say, "I am with a glass." And when I used to call him in the morning, he used to say, "I am in a class." So we found a middle way out, and he's the only person who talks to me in the afternoon, 3 o'clock, 4 o'clock, 5 o'clock. And we have tried to establish a bonding and a partnership, and it seems to have done reasonably well, even while he was not in the country, dodging Dr. Sujata's bouncers, drafting letters. 2 minute में मैगी नूडल्स भी नहीं बनता, लेकिन इसके लिए लेटर बनाओ, स्टैम्प लगाओ, ये करो. I think he's been a good guy. I'm not sure if I have been a good president, but I think I tried my best, and I wish all the best to the next